Hey, this is Randy Bond with Bond Insurance Solutions, and this is just a quick video that we put together to kind of help our clients get an update on some of the big changes that are coming to Medicare in 2025. And they are big. And I'm not talking about like the commercials where they talk about big changes and all that. And they're really just talking about little bitty changes in Medicare Advantage plan benefits. This is a much more fundamental change, and it is going to affect everybody. We are going to need to review your plan this year. And if you're watching this and you're not one of our clients right now, I want to say thank you. You've got a good friend that sent you our way, and this affects you as well. Every person on Medicare probably needs to have their plan reviewed. The changes are that significant. This is really the biggest changes that we have seen to Medicare since 2005. And the reason why it's a lot more fundamental is because it affects the prescription drug coverage. And that means that everybody is going to have some kind of impact from this in the next year. Normally, when we're working with our clients, only about 20 to 25% of our clients need to change their plan from one to another during the given year. And we're happy with that because we like that our clients are happy with their plans, and we understand that change can be difficult. But what we're seeing and what the insurance companies are telling us, everyone in the Medicare industry is indicating is that probably 80 to 90% of people on a Medicare plan are probably going to need to change their plan this year. It's that big on the changes. Now, I don't know if the numbers are going to be that big, but what it does mean is we need to look at your plan just to be sure. We don't want there to be any nasty surprises come January 1st. So this is not the year to sleep through Medicare season and just hope that everything works out okay. And that's why we're putting this video together. We want you to be informed that there are big changes that are coming. We don't want you to be surprised. And we want to have plenty of time to be able to help you out in the days ahead. So what is driving this is the Inflation Reduction Act that passed a year or so ago by the Biden administration. It has two really important provisions that affect all Medicare prescription drug plans. There are a couple of others, but I just want to highlight a couple of them and let you know both the positive and the potentially negative impacts that it will have for people. So first, some good news, at least for some, maybe most of the people that are watching this. The donut hole is going away. That is great news. I know that that's a bear sometimes for people when your prescription meds go from like $45 to a couple of $100 or more for a 1 month supply. So woohoo, cheers everywhere for that. The second really big thing is for the first time ever, there is going to be a $2,000 per year maximum out of pocket. Folks, this is a safety net. This is a cap on how much you would spend. Up until now, there has been no safety net. Your cost on prescriptions could be unlimited up until 2025. So there's some good news here. And that means for a lot of people that have been hitting the donut hole, this will impact you because once your prescriptions reach $2,000, this is what you're paying at the pharmacy counter, any of your prescriptions for the remainder of the year, once you hit that cap, will be $0 for the rest of the year. That's some really good news. So if you've had some expensive medications, some things going on, you could be looking at some really positive changes in 2025. For all of us, there's probably a question of, okay, Randy, what's the bad news? What's the other shoe that's going to drop? Well, the reality is that Inflation Reduction Act did not authorize or in any way give Medicare the ability to reimburse the insurance companies for these additional costs that they're going to be eating. So remember, the cap is 2,000, and that means that anything above that, the insurance companies are basically having to figure out how do we factor this in? And what this means, and this is the unfortunate thing, this is going to mean more cost share for Medicare beneficiaries like you. Anytime you hear the government talking about taxing or increasing costs for companies and so forth, you can understand that's all going to come down to us. It all flows downhill, and that's the sad reality that we're going to see. So what does this mean for you? A number of different things. Number one, higher monthly premiums. If you're on a standalone prescription drug plan and you're paying a monthly premium, some of those could go up a fair bit. If you're on a Medicare Advantage plan, depending on what market you're in, what county you're in, some of those that may have had a low or no monthly premium might start having a monthly premium. You're going to start seeing some higher deductibles. $590 will be the maximum for deductibles in 2025, but that's where you pay the full price of the medication until you reach that amount, and then you move into the next stage. What we'll also see is that there will be more plans with deductibles, and that could also mean the Medicare Advantage plans, which a lot of them, at least in the markets that I work in, typically don't have deductibles on the prescription coverage, but this could change. And so we want to make sure that we take a look at your plan because this could affect how much you're paying during the months of the year. And we don't want there to be any surprises. We want you to be able to plan ahead, number one. But number two, if we can save you money, we want to do that as much as possible. Third or fourth, this is a biggie. We may see some higher cost share on tier 3 and 4 medications. So if you've got medications that are tier 3 or tier 4, you may have been paying $45 a month, $47 a month, something like that until you hit the donut hole. What they will probably do is do away with the set copays on some of the plans. And this is what I want to stress. I don't have all the details of all the plans, and I certainly don't know what it will do to the plan you're on, which is why we need to do the review. But what they're looking at is doing away with many of those set copays and moving to what they call a co-insurance, where you pay a percentage rather than a set amount. So if you're taking something like Eliquis, which is about a $600 medication, that means that you could be paying $150 or $200 rather than the 45. There will be no $45 per month stage. It will feel like the donut hole, even though there is technically no donut hole. This is why we need to review. If you hit the donut hole, let's take a look. If you're not hitting the donut hole, let's take a look, because that monthly premium, the deductibles, all of that can have an impact on your bottom line, on your cash flow, and that can make the difference between choosing between groceries and medication. And we don't want you to be in that situation if we can avoid it. For those that are on a Medicare Advantage plan, there's also been the reality that the Medicare reimbursement rate, what Medicare pays the insurance companies that take care of you, did not match with inflation. So that means that the Advantage plans are probably going to be trimming where they can, particularly on some of those extra benefits like dental, vision, and hearing, over the counter and things like that. And so if those are important, we may need to shop around for a better plan. And we also need to watch the possibility of higher copays for your doctors, specialists, hospitals, testing, those kind of things. So all of that is going to be important considerations, more so than any other year. This really is the biggest year that we need to look at your plan. I really cannot stress that enough. It's not the year to ignore your Medicare plan. It's not the year to sleep on it, to hope it is all okay. Assumptions are costly, and we don't want you to be in that position. One of the other things that may be happening, particularly on the standalone prescription plans, is we're seeing consolidation of plans and elimination of plans. We may even see some of that on the Medicare Advantage side. It's not to be alarmist or anything. I just want you to be aware that there could be that significant of a change in some of the markets, and we need to take a look and see. I know everybody gets an annual notice of change, but a lot of people don't read those. That's what we're here for. We see all of these changes, and we can help you. We can guide you. We can be your limo driver through the maze of Medicare. We know the way around, and we can help you with that so that you can sleep well at night. And if we do this early enough, you can sleep all fall and not worry about it. So don't ignore the Medicare plan, but ignore every one of those Medicare commercials, please, and all of the telemarketers. Medicare will not call you ever. If you're getting a call and they're telling you that they're from Medicare, they're not, they're lying. They're simply salespeople trying to get you to switch your plan. And if you switch your plan, then you lose me as your agent. And we don't want that. So, and I don't want you to lose someone that'll be that personal guide with you. I mean, if you try to call that 800 number back, are you going to get the same person? So what do you need to do now? Number one, don't panic, don't stress. Just simply letting you know, none of this affects the plan that you're on right now. Your 2024 plan has not changed. It's still the same, will be the same all the way to December 31st. We're simply letting you know this so that we are not dilly-dallying too much and miss an opportunity to change. I understand change is hard. The older we get, the harder it gets to change. I get it. But this might be a year that we need to look at a change because we want to change your plan, not how much you're spending. Change is coming. We just want to make sure we manage the change up front. So this is nothing to panic about, nothing to stress about. You can rest easy. We're here to guide you through this and to do what we can to help save you the most money going forward and to find you the most benefits that we can. The market is changing, but we're going to guide you through and help you out as much as we can. So good news is we now have a client portal just like you do with your doctor. So if you're watching this, you probably have access to online stuff and you can set up a portal with us. This will help tremendously. This will enable us to much more quickly take care of you. And if you do this, you're going to be number one in the line. We will look at your plans first, and that means that we can contact you once October rolls around. We can't look at anything until October, and we can let you know if we need to set up an appointment and get together and make a change, or if we need to do it over the phone, or if we can do that online, whichever those might need to happen. Or we can just tell you, good news, you're in the right plan. Stay put. Enjoy the rest of the fall. Go for a walk in the woods. Enjoy the fall leaves and all that kind of good stuff. I'm looking forward to some fall weather, by the way. And if you're not one of our clients, we would be delighted to help you out. If one of your friends lets you know about this video, thank them, and we would just appreciate the honor of helping you. We are licensed and appointed in all of these states, Texas, Oklahoma, Arkansas, Louisiana, Mississippi, and even the state of Maine. Fun story behind that. And we can help you. We don't work with every single insurance company. We work with all the big dogs and some of the smaller carriers in all of these states. Now, going to that portal, the link is down below in the description of this video. And you can just simply click on that link. It's going to take you right here to this page. If you'll go over here to this little hamburger menu, as they call it, and if you click that, it's going to take you to this little box, and you can just click the sign up, and that will enable you to set up your portal, set up your profile. And then when you come back, all you need to do is go to this login button right there, and it'll take you right to your portal, and you can update. Make sure that around October 1st, mark your calendar and do a quick little update so we can make sure that we have the up-to-date information on your medications and your doctors and so forth. So when you click that sign up, it's going to take you to a page just like this. Create a profile, just fill in the information, and then it'll take you to some other pages where we need you to make sure that you enter in all of your medications. Use the actual name of the medication you're taking. So if you take a generic, don't tell us the name brand, tell us the generic, the actual name of the medication you're taking, also with the dosage, the quantity, and so forth. Let us know your favorite pharmacy, or if you've got more than one, let us know what those are. All of your doctors, even if you only see it once a year, we want to make sure that it'll work with the plan that we get you set up with, and your hospital. If you're having home health care, durable medical equipment like an oxygen machine or anything like that, make sure you let us know that as well so that we can try to get that matched up as well as we can for your situation. Then we can set up an appointment and we'd be glad to meet by phone. We can meet by Zoom, or we can meet in person if we're in the same geographic area. We will be set up in the River Valley and in the Texarkana area all Medicare season long. So we'll be back at the Great Commission Baptist Association office on South Zero Street in Fort Smith. In Sallisaw, we're going to be back at the Wheeler Event Center right behind the new Chamber of Commerce building right across from the Agent and Mallory funeral home. Fairly easy to find us there. And then Texarkana, we'll be back at the Southwest Center on the Texas side of the line. And if you're in the Arklatex area, Arkansas, Louisiana, or Texas, we can help you with the plans right there in person. We'd be glad to. And then fourth, tell a friend. I can promise every person on Medicare needs help this year. If you've got a friend that doesn't have a guy, I know a guy. And I know an even more beautiful woman that he works with and is married to. that would be glad to help you guys out. And we are grateful when people tell others about us, and it's just the highest compliment that can be paid, and we are deeply honored. So, but let them know this is the year that you need to be a good friend, and let them know you need to have your Medicare plan looked at. And if you need to drag them into an appointment with you, feel free. And those locations where we'll be, we're trying to get out of the retail locations so that we can have more privacy, a lot more quiet, and goodies, snacks, coffee, and all those kind of things. So it's a good time, and we will enjoy seeing you. I think this is one of the things I'm looking forward to. Is we need to review almost everybody's plans, which means we get to talk to just about all of our clients, and we've got great clients, including you. So thank you so much. So just some reminders here. Don't panic. We're here to help. We've got you. We've got time. If you don't dilly-dally, and please don't wait to the last minute. Go ahead and start doing this. That way we can help you right from the very beginning, starting on October 1. We can't sign you up until October 15th, but we can certainly address your situation, review your plan, and make sure that we know what we need to do when October 15th rolls around. So go ahead, set up your portal, your profile there. And then if you want to, you can go ahead and set up the appointment. Link is right down below to our website where you can find that, and tell a friend, share this video. Go ahead and send it on. You send the cat videos, send something that might help them out as well. Send them this ugly cat. If you need to get in touch with us, bondinsuranceSolutions.com is the website. Phone number is right there, and then the email you can see below. By the way, if you're calling, please make sure you leave a message. We want to hear your lovely voice. If you don't leave your lovely voice there, we may think you're a telemarketer. We get all those kind of crazy calls too. We try to make the best use of our time, especially as we're getting into this very busy season, the busiest we will ever have. And if you don't leave a message, we're going to think you're probably a telemarketer, and you may not get a call back. So critically important. We may not be able to get to you right away, but we'll get to you just as soon as we can. Hey, thanks so much for watching this. I do have a longer video that gives more explanation, and you can see that in the link right here, and watch that, and that'll tell you more about the maximum out of pocket and the payment program that they're going to have for medications, which is kind of an interesting thing and may be helpful for a lot of you watching this. So thanks a lot. God bless. And we look forward to seeing you really soon this fall during the annual enrollment, October 15th to December 7th.